Thank you, Victoria and Stephanie. Hi, folks. It's Chris Stegg with Enabling. We're a Microsoft Gold partner. We do a lot of work with Microsoft Teams. I actually worked for the phone company, Avaya, before coming to Enabling 15 years ago, so pretty far back. Today, we're going to talk about an upcoming change due to some legislature that was passed a year and a half ago. And I'm pleased to be joined today by Lance and Jason from Colorado State University in Fort Collins. They're going to be kind of the hopefully a opener for you folks on the call to also share and to learn. Guys, you want a quick intro yourself?
Sure. Hey, thanks, Chris, and thanks everybody, especially Stephanie, Victoria, and Garrett for hosting office hours. We're big fans of the show. So my name is Jason Hewitt. I'm the Director of Networking and Telecommunications at CSU. I've been here about 21 years. New to this role, but softy from way back. Take it away, Lance.
A softy from way back. I'm not sure what that means. Hey everybody, Lance Spots. I've been here about at CSU 21 years as well. Jason and I didn't get hired together, but we've been here, kind of working hand in hand for quite a while. So I supervise the team that manages our M365 presence. Yeah, and good to be here. And I'm going to throw it back to Jason, I think, to kind of give an overview of our project.
I think we'll probably give it back to Chris for a minute, but we've got some other folks from our team that are on the call today. So giving a shout out to everybody who's been a part of our project. Chris, back to you.
Thank you, guys. While these guys give a brief intro of where they are with Microsoft Teams, can we get a thumbs up from the community if you are also using Microsoft Teams for phone services? That way we know how directly to address you guys versus maybe starting at a little higher level. While I'm doing that, back to you, CSU, for a review of kind of where you are with Teams right now.
Cool, thanks. And Lance and I have an awesome dynamic, so I'm sure he's going to chime in and either tell me that I'm blowing it or correct me when I'm wrong. So, and the rest of our team should do the same as well. So our team's voice journey began several years ago. And honestly, our entire project was driven by two big pieces. First, a desire to rethink how we're serving communications and collaborations across our campus. And also move in order to take advantage of some new security functionality with an A5 license suite that allowed us to really sell this to the administration as an improvement to our campus security posture with a free phone system, which is fantastic for us. We have over 9,000 users when we started the project on a legacy open source voice and VoIP environment that while it had served the campus well, it had been deployed for over a decade. You know how fast technology changes. We quickly realized that we weren't able to necessarily support all the use cases that we wanted to on that system. And also there were some questions about support model for that open source platform. So we, as of a year ago, embarked upon a 1-year pilot, which completed this last December a year ago, to bring on the campus IT community at CSU, about 600 users into Teams for Voice and migrated away from our legacy VoIP environment. That proved extremely successful and set the stage for us to leverage a new support model for the way that we deliver telephony services at CSU, whereas our central Department of Telecommunications had provided all user support and deployment for all of our VoIP solutions previously, we were now engaging the campus IT community in a way that allowed the subject matter experts over endpoints and the folks who developed those relationships with their users to serve as kind of that tier 1 support, and allowing our telecom and VoIP services team, as well as Lance and his M365 administrators, to serve as the good tier 2, so we could develop a better relationship with those folks. It turned out that we went live with the pilot in January 2020, right about the time that COVID hit. So that really met us with a very fortunate opportunity to leverage Teams to address a whole host of remote work use cases that we wouldn't have otherwise been able to on our legacy VoIP environment. And we specifically worked with some groups like our registrar's office, our health network, and particularly our admissions department to implement call queues and to take their user staff onto Teams for Voice so they could deliver their services remotely and better engage with our students, both while they're in attendance and on their way in the door. We are in the midst of, well, I guess we're about a year into a 3-year project that we have identified to move all 9,000 users over. As of today, we're at about 1,500 users having been migrated. We came up with that 3-year plan based on some guidance we'd heard anecdotally and from some folks to suggest that about 250 users per month was about the average migration cadence. And so far, on average, we're pretty close to that. And of course, we'd like to move faster. 3 years is a long time for a project like this to exist. We've been focused so far on end user and shared mailbox scenarios. And we actually just completed that shared mailbox scenario and are planning in January to convene the team to start strategizing what we're going to do moving forward. We've kind of tried to adopt an agile approach to how we do this, where we pick a use case and we take a couple months to address that in a sprint. And then we come together with our stakeholders and sponsors to decide what's the next use case we need to tackle in January. Right now, I think we're looking at some of the more advanced use cases like common area phones or receptionists that we haven't tackled previously, and also potentially exploring call center solutions that we might be able to tackle. So that's kind of a snapshot of where we're at today. Happy to answer questions when we get to that point. Chris.
Jason, I don't believe your slides are showing any longer. It looks like you're advancing
yeah,
slides.
I took them down so we could focus on the.
Oh, all right. Sorry.
Thanks. Anything to add, Lance, or other CSU folks?
I think that was a great summary of current state. So, yeah.
Thank you, Jason, very much. So, this is Chris again. I'll go through the E911 problem statement really quickly. You probably all know it. You have multiple buildings on campus. You may have multiple campuses, and every color has to match the 911 public safety answering point, or PSAP, in that geocode, in that zip code, in that local area. So if your folks are in 123 Front Street, they should meet the 911 center there. However, in a VoIP world, in a soft phone world, if you go with old tech and you have a user who all of a sudden starts to work at 123 back and they make a 911 call, and your calls are all centrally trunked. In other words, they're going through an SBC, a session border controller, or a centralized telecom circuit. That call will end up going to the 911 center where the original person was located, and that's not applicable in the mobile world and soft phone world. Teams has this thing called the Location Information Service, LIS, and this is a database that allows you to program your physical addresses and your IP subnets and make a database and equate the IP subnet of the end user to the physical location of the building that they're in. It even can ingest layer 2 information if you've got LANs that span multiple floors or multiple buildings, as I'm sure many of you do on campuses. So that's the purpose of the list. So what Microsoft's provided, and this goes way back to Skype for Business, is a E911 dynamic E911 compliant service, so that if the orange person all of a sudden shows up in the green location, by virtue of their IP address changing, then they are going to therefore be sent to the correct 911 center, because the location information service, the LIS, has the new information in it about their location and whereabouts because they've moved and registered teams from another location. That was all well and good while on-prem, but what you've got on the 2021 and especially the 2022 docket is for work from home, you also have to tell the public safety access point or answering point where the end user is. And of course, there is no IP address that you know about for a home user. So that creates a new problem, one that Microsoft is just about to solve. We're on a couple of different tenants here at Enabling looking for this every day, and we saw one today that has it, and we're told that others should start to see it tomorrow, so that you can comply to Ray Baum's Act. There are two parts of it. The second is what we're talking about. In less than a month, you'll have to, if you're a Teams phone service user, make sure that your users are aware and make a change to your system to be compliant. These other laws, the first part of Ray Baum is already due, and that was for fixed devices that are on premises, your IP phones, for instance, that are either static or moving around. And then the other law that's been in place even longer is Kerry's Law. We have run into some organizations who aren't familiar with that either, and they have to, when someone dials 911, what you have to do to follow that law is alert someone else in the organization, either on site, ideally, or somewhere in a central location, so that at least someone else in your organization knows that there is a 911 call that's been placed. And Microsoft Teams can support that via an instant message pop-up or bridging another number into the call so that they can either listen on mute or interact with the caller. Ray Baum's Act Part 2 is due in less than a month. What you'll need to do is, number one, talk to your telco provider. there are some SIP trunk. This is, for instance, if you're using a direct routing, that is. Microsoft will support this, so you don't need to call them if you're using calling plans. But for number one, you need to make sure that your telecom provider can take the information in the location information service and do something with it. That is to say, route it to the correct public safety access point. If you're using something called ELIN or PS Alley for some of your locations, that is not an approach that will work on January 6th. Your new approach has to be using the lists, which for your end users remotely will work in a similar fashion as that person moving from the orange to green. But what you're going to have to do is make some configuration changes so that there's a pop-up in the Teams app when someone's on an unknown IP address or subnet, so that they can confirm their location. I'm at home, I'm at Starbucks, I'm at a hotel. You're gonna have to do some testing. You can use the number 933, and that's a 911 test call, which will read back to you the assumed or their impression of where you're located at that time. And importantly, you're gonna have to tell the users, because if the users are using the old typical Microsoft app approach of just clicking OK the first thing they see, they may be very well positioned in the wrong place. And if they have to dial 911 from Teams, be in a big problem because the call won't be routed to the correct location. So that's quickly through, this is going to be the user experience. And I want to give the mic to CSU for a moment to learn how they've been handling e911 and also what their plans are for this. And I hope that instigates some questions and some other best practices from the group.
Thanks, Chris. I think how have we been handling 911 with loads and loads of Ambien to try to get good sleep at night? To be real honest, by the way, I forgot to mention CSU, we're a direct routing school. I wanted to toss that out there so everybody can kind of level set where we're at. So I'm sure, given that there are some folks in higher education in the audience, are not alone in being in a really challenging network environment. We do not have the luxury of mapping particular subnets to particular buildings. We have multiple subnets in every building, and for legacy reasons and use cases that we probably are hard pressed to be able to tackle, are not in a position to be able to guarantee that a particular IP address or subnet lives only in one particular building on campus. Moreover, it gets harder. Ideally, we want to map particular data jack at the wall all the way back to a switch port so that we do engage things like LLDP to provide good information about where exactly a user is. It turns out we have a concept called a subnet manager at CSU, a group of some 200 folks across our campus network who actually have keys to their local communications closets and permission as of today to change network patching in whatever way they see fit and best addresses their use cases. And so that's a challenging environment as we think about how to develop the data we would use to populate the list that Chris mentioned earlier. And so we have been relying on static location data that we're either providing to CenturyLink, which is now Lumen, for some of our PRA-based connectivity to the PSTN, or now we're contracting with Intrado to deliver some of those services related to those users that we've migrated to use for voice. So we're leveraging Intrado's ECRC, their emergency call response center, to route calls to the appropriate PSAP based on a question when we don't provide good location data because the user is coming from outside of our network, to make sure, are you at Starbucks? Where are you today? We don't know where you are. And then to enter based on that location provided by the user to route them appropriately. We've also encouraged the campus HR community to work with all of their users to make sure we had accurate on-campus location data within HR systems, so we would have a good data source to pull from for those workers that are still on campus. And frankly, we've been waiting for today. And the good news that Chris has found that we're actually starting to see some changes to the UI that we knew were available in Skype for Business previously, baked into Teams so that we have an ability to start to address this at the end user level. Go for it, Chris.
All right, thank you, Jason. I was just replying to a couple of chats. I'll do that more manually now. And you can open the mic if you want to raise your hand, folks, to answers to any of these questions if you're handling them in some other way. Marcos asks, what about if they're on VPN? There's no good answer to that, Marcus. They're going to get the IP of the VPN, and they're going to appear like they're in some nebulous range of IPs assigned somewhere in your subnet. in your environment. So you will likely though get this pop-up. Let me just reframe that. There's two reasons why you don't want to use Teams on a VPN. This is one of them, and two is because you're going to be getting a tunnel with an IPsec overhead and not good performance out of it. That's just a best practice. But my assumption is you'll get a range that's not defined by the lists in that situation. Remember, if you're doing it the next gen way, you're putting in all of your IPs that actually are affiliated to a building or a floor, etc. And if that address, and if you're coming in from an address that's unknown, then you're going to be able to put in this address like was shown on the screen. However, if you show up the next day from Starbucks and you have logged in via the VPN and you get the same IP, then the system's going to think you're at home where you were the other day with that same IP. So it's not a good solution for VPN users for those reasons. Subnet mapping of multiple floors and even civic locations from Mac. Great question, and there is no good answer to that, except if you've got the wherewithal and you happen to own the Cisco or Foundry IP logins, unlike the CSU folks do, you can go in and you can start to set up different VLANs from your layer 3 switches. If, however, you've got a building with an MDF only, you don't have an IDF switches on each floor, that's kind of an impossible situation too, where everything home runs back to a specific data closet or LAN switch room. In that case, your only option is to map the MAC addresses to their physical wall jack ports and send out a poor college student or intern to do that dirty work. Don't shoot the messengers here, by the way. We and the folks at CSU are just telling you what the law requires and how you'd attack it. It's independent of how feasible it is. But what Microsoft's done is given you the means to get those details to the public safety point, which is their responsibility. It's up to us and you to figure out the best means of actually being accurate in that situation. Victoria's got her hand up. Go ahead, Victoria.
Yeah, Chris, I wanted to say I also invited someone from our Teams PM group or / kind of engineering. I don't know the more generalized term to use for everyone here, but Dave, if you are able to come off mute, I think you might have wanted to say a few points as well, because, you know, this feature hasn't, I know a lot of you aren't able to see it in your client just yet either. And so some of this might take some trial and error as well. But I don't know if Dave is able to come off a mute as well in case he has a few pointers or if he wants to say things later.
Thanks, thanks, Victoria, and good afternoon, everyone. As a quick intro about myself, I'm what they call a technical program manager within Teams Engineering. So the folks, obviously, you know, that develop, design the product. I work with several universities really to take where they are today and to accelerate their capabilities around voice. And so obviously 911, dynamic 911 is front and center to all this. For the presenters in the call, if someone could make me a presenter when we have a moment, I just had a couple of slides I wanted to touch to when you're ready, Chris, to just supplement the discussion.
Yeah, and Chris, if you want to save it to the end, because I don't want to disrupt your flow either, that's also an option.
Welcome, Dave. Feel free to jump in, and I can't promote you, but I think Victoria.
I've got it. Yep, took care of it. Thanks.
So thank you. I promise I'll keep it brief. All right, so let me know once you're able to see.
You can see it.
Okay, so a couple things as Chris noted, you know, when it comes to 911 and dynamic 911 readiness, that the one thing to note is that the two laws available are really kind of the starting entry point. Further beyond that, at the state, at the county, and even some cases at the city level, there may be official, more restrictive guidelines that you have to meet for what does that, you know, dispatchable location interpretations mean. And so one of the things, this just gives you kind of an example. This is actually sourced from Intrado, What you see here are the states that are in blue are where those more stringent requirements apply versus the ones that aren't, summary roll up under that federal mandate by default. So the key here is you'll want to review with your legal regulatory teams to understand what is the requirement for the locations that your campuses do operate, and then based on those requirements, how would you take that forward within teams? The other thing I also wanted to touch on briefly, also to Chris's point, is, logically, what are the different components required for all this to come together? So the first one across this, you'll see at the top here. Let me go back here a second. See at the top here actually has to do with the trusted IP address, as Chris mentioned. And so the key here. This needs to summarize the public IP addresses as seen by the service. So I saw in the chat there were some questions around, well, what if VPN? How does that come into play? So if users are at home or they are connected through VPN, how that VPN connection is routing the signaling traffic for teams, not so much the media, just the signaling, is what will follow for what trusted IP is seen by the service. So if that's going through your campus data center, that's the IP address that needs to be defined for the Teams client to say, this is a defined location within your organization. Second to that, then obviously you have the location information database. And so this is where you'll need to map, again, the initial static address locations. One thing to note is with this new mandate, this now requires having those geo coordinates paired to that. The reason that's key is we've always had static emergency addresses in the past, but the geo coordinates wasn't a requirement. So as you look to ready your environment, if you do have some of those addresses from prior, there is no way to migrate those. So what you'll have to do is you'll have to actually delete and recreate those now with those geo coordinates provided. And again, that's really the foundational at the static address level. The third thing then I just wanted to also then talk on briefly, especially as you think about the use case with direct routing, is you've got two other elements around calling policy and call routing policy, which basically dictates when an emergency call is placed, who gets notified. But then second, if you do have an emergency call that's placed, which of those, in the case of direct routing, emergency providers will you route that through? So there's effectively three today, Bandwidth, Intrado, and recently IntelliQuint. And then lastly, if you need to do any mask translation. So for example, often we see people are migrating from legacy phone systems where you had to dial a 9 to get out, or an 8 or another access code, or even if you've got someone visiting from another country instead, like say, for example, you had someone from EMEA where they're used to dialing 112 in that case, that through these two policies, you have some translation logic you can put in place to convert that to the right format, 911, so that that's routed appropriately. And then the last thing I'll just touch on briefly, just going to fast forward here on a couple points, but with this new work from home capability, a few things I just wanted to highlight is that for this to effectively work, it is dependent on having the location service of the operating system enabled. So that is in the case of Windows, but it's also in the case of Mac. If those things aren't enabled, we do know that there are some institutions, that maybe have historically had that turned off by default. But the key to note is for this to work, that does have to be re-enabled instead. If in the event that it's not able to do so, what will happen is users will get prompted to either attest or manually enter in their location, but because we can't validate it through that location service, what that means is if they place an emergency call, it'll still go out, but it's going to go to the National Screening Center where they're going to validate the address received and reroute to the most local PSAP instead, versus getting directly sent to the PSAP if those services were enabled at the onset. So hopefully that helps. Just a couple points I wanted to highlight, because this does come up quite often in some of the discussions. We do see in working with other institutions, and other engagements we've also worked with enabling on. So I just wanted to highlight those few points, and with that, I'll turn it back over to Chris.
Thank you, Dave. Does anybody else have any points or pointers for answers to these challenging questions? I'm cruising through and getting to the questions as quickly as I can, but open to other feedbacks.
Chris, I think that last question in the chat is interesting. How does Teams nag the user into filling this information out? Is it prompting automatically every time? What does that user interaction look like?
That may be a better question for Dave because we haven't seen that in our own environment yet. So Dave, do you happen to know?
Sure, great question. Yeah, as the user launches the Teams client and based on the IP address, if they've provided that address, that will persist. However, if they change locations and say that there's not a match, then they will be reprompted to provide that information instead. And if they choose not to do so, or they just hit cancel in that case, what'll happen is should they make a call, they're just going to go to the National Screening Center. And then assuming that they're able to speak, then they would reroute to the PSAP most closest. Great question.
And that's in the case of calling plans. You have to be quite careful if you're using a direct routing solution to ensure that your telco will be able to, like I said earlier, handle the location information when you send it to them, and or if they're unlocated, have a means to get them to a centralized emergency response call center. Dave mentioned the three, Intrado and Bandwidth and Eloquent. These are the providers that you can kind of get to help on the direct routing side for carrying that information from the list out to the public safety answering point. So I go back and those are the certified ones. I go back to my original advice where you need to check with your existing telco. They may have the means to handle some of that, just not be on Microsoft's list yet.
Great. I'm going to let you guys continue to filter through some of the chat, and we can hang on for a couple questions, or we can just put contact information in here and let folks reach out to you. Honestly, we don't get many sessions where there's this much interest in follow-up and questions, which is great. It's a timely topic for sure. So I'm going to go ahead and stop the recording and just say thanks so much, guys, for being here and for your expertise and experience.
Yes.